that the health service could swiftly become overwhelmed. Well, earlier I spoke to Christina Pagel, who's Professor of Operational Research at the University College London and a member of the Independent SAGE Group, and Andrew Rosindel, who's Conservative MP for Romford. Andrew Rosindel, Christina Pagel, thanks very much for coming on the programme. Let me start with you, Andrew Rosindel, if I may. So we hear just now that the R number is at 1 or just below 1. And yet Romford, like the rest of London, your constituency, is in tier 2. Do you think that is unfair?
I think the whole thing is unfair. I understand why the government are doing it, but I think the mood of the country has changed. I think we need to get Britain moving and get Britain back to work. I think that too many livelihoods and jobs are going to be lost out of this. I understand why it has to be done, but I think when we look back, I fear it's going to be seen as a huge overreaction.
Christina Pagel, a huge overreaction? What do you think?
Well, I mean, I disagree. Back in mid-September, we were averaging about 20 deaths a day from COVID. Now it's over 400. And there's no reason to think that without lockdown, that wouldn't have carried on going up. The OECD released data today. There was an article showing that the countries that had the least impact on their economies are the ones that had the lowest death rates and have suppressed COVID the best. So it's not the case that it's the economy or health. It's both. If you suppress the virus, you can have an open economy.
Christina, you can see why people think that it's fundamentally unjust if they live in a village or a town or a city that is seeing very low infection rates, and yet they're lumped together, with the rest of Kent or the rest of whichever areas in tier 3, for instance, and they've seen their economic and social life virtually shut down.
I mean, there are very few places that have very low infection rates. I mean, remember that in the summer, the government imposed quarantine from external countries at rates of 20 cases per 100,000 people. There is nowhere in England that is that low. And the key isn't just how many cases you have now, it's what the growth rate is. So back in October, everyone was saying, oh, the southwest is really low and it's fine, but it was going up and the hospitalizations went up a lot and they've only just started coming down about a week after lockdown. So it's not as if it's just fine just because currently there aren't that many cases. You have to think about how COVID spreads, and it spreads with contact.
But a lot of it is also down to explanation, isn't it? Especially if the government keeps saying that they're following the science. So, what people want to know, and they haven't really had an answer to yet, is why, for instance, is it more dangerous to go to a restaurant where you sit apart from each other than to go to a gym?
What's dangerous about going to a restaurant is the fact that you're not wearing a mask, you're talking, and often you're laughing. And those kind of situations are just where it seems to spread easiest. I mean, it's that kind of socializing. We saw in Canada, they had Thanksgiving at the beginning of October. 3 weeks later, they have massive spikes and are now having various lockdowns across their cities because of it. And we're facing something, very similar with business.
The problem is the argument, the logic of this argument is that we keep locking down and we go on locking down. And there's no one saying, hang on, what is the effects of the lockdown long term? Is that going to be devastating as well, or even worse than the effects of the virus? This is what nobody's telling us. And my instinct, and I talk to my constituents, I can tell you, most people now feel that this has gone a bit too far, that actually we should be handling this differently. The idea we're going to stop anybody dying, of course, people will die. There's always people dying of pneumonia and flu at this time of year. And it does seem to me that all the figures are being muddled up and inaccurately recorded as well.
So if you were in charge now, if you were Prime Minister, what would you be doing?
I would be protecting the vulnerable very strongly in every possible way we can do, but allowing everybody else to go back to work, to open up their shops and businesses, to keep the economy, get the economy back on its feet.
Okay, Christina Pagel, if Andrew Rosindel was Prime Minister and what he just described to us would become policy, what would happen to infection rates and death rates in this country?
Well, I mean, there wasn't any policy. It was just we need balance. But how do you have balance when you have a virus that spreads every chance it can get? What we needed to do is have a really good test and trace system, have really good messaging, have support for people isolating. We haven't managed to do that. It still hasn't got any better. And so we're forced into these kind of lockdowns. It's a terrible thing to do. But if you just let COVID run free, then if hospitals get full, they can't treat any type of condition. It's not just COVID people who suffer, everyone suffers. People aren't willing to go out, people do not spend. Consumer spending in the OECD dropped in the countries that had the most COVID. It's not the case that somehow if you let people go, they'll go out and spend if there's COVID rampant. Who wants to go shopping if they think they're going to get sick?
Andrew Rosindel, do you think that if we had locked down earlier when we should have done back in March, we wouldn't be faced by this dilemma right now?
Look, there's lots of what ifs. Potentially we should have locked down earlier in March. There's lots of things that, in hindsight, we can look back and think, if only we had done that. There is no one straightforward answer to all these different questions. I am thinking, and I say it again, I am now thinking of the effects on the British people long term. In the new year, Boris needs to rethink this, be bold, face this down, protect the vulnerable, but let's get Britain working again.
I mean, you can't just, none of it really makes sense. You can't just protect the vulnerable. The effects of COVID are really bad. The effects of lockdown are really bad. But if you let COVID go, it doesn't protect the economy. That doesn't help the economy. And with a vaccine around the corner, I mean, this is our chance to really get into the situation where we can protect everybody and not let people die in the meantime. I just can't imagine anything worse than being one of the third wave to get COVID when we know that there are vaccines that are coming in a couple of months. I mean, this is the time to say, actually, you know what, we can see the light at the end of the tunnel. Let's just get there with as minimal illness and sickness and death as we can. If we have, good support for businesses, good support for people who are really struggling, then we can come out of this in a position to open up the economy and make it thrive again.